I just have to go find an answer if I don't have one. And I started finding out that the things that I'd been trained and taught forever weren't necessarily all true. And there was a huge correlation between overall health and dental health that I had no clue about. And that's what completely changed my practice, because I started finding these answers, treating things in a different way, looking at everything in the mouth in the view or scope of how does this affect overall health? And our entire practice started growing because all of a sudden people said, this is the kind of dentistry that I want to have. I want to make sure that nothing I'm doing is going to be taking me down the wrong road here. And vice versa. I have been sick for forever. I've seen every doctor, and my story, I've seen every doctor, no answers. Maybe it's in my mouth. And I have since found out that 60 to 80% of chronic disease is related to the mouth.
Welcome to the Know Your Ship podcast, presented by eHub. I'm your host, Frank Dolce.
Fun.
Are you nervous?
No.
Are you anxious about this?
No.
Are you sure?
Yes.
A lot of people who sit in this chair with me get anxiety.
Yeah, I just do this so much. It's just a conversation. We're just chatting.
It is. That's exactly
It's just fun.
how I think about it. And this is a conversation with the one and only Dr. Michelle Jorgensen. You didn't grow up at Jorgensen.
No, I was a Coles growing up.
A Coles.
Coles.
Is that a Coles from Utah?
Yes. Yep. I grew up in Utah.
You're a Utah gal.
I am.
Oh, nice. Okay. Where does Coles come from?
It's a great question. A lot of our ancestry is in Britain and England, but we actually ended up in Emery County in the middle of Utah, in the middle of nowhere, because my father is a dentist as well. He graduated from dental school in the late 70s when interest rates were sky high and there were no jobs for dentists.
Oh.
So he had a buddy who had moved down to Emery County, and at the time they were building a new coal burning power plant because all the hills surrounding those valleys are full of coal. So they were building a new power plant and the business was booming. There were, more people there that had insurance, dental insurance, because they were all working to build this plant. And he said, I have so much business. Can you just come down and help me? So my dad went down, moved the family down, thought they would spend a year, and stayed there for 20. So it was certainly not
Same
anywhere.
old story.
Yep. So it was not the place that our family was from. We had no family connections or ties there whatsoever. But it was a fabulous place to grow up.
I'll bet.
Yeah.
Was it like the storybook, your dad was he the only dentist in town? Like, he was the dentist, but then he had some medical background and people were coming, he was like the small town dentist. Everybody's coming to him like, hey, I have this issue and I have a foot thing and can you fix that?
And not as much. There were a couple of dentists.
I was so hopeful.
But he did that for us. I mean, I'll always remember that one day we had a canal in our backyard, and this was the days when, the canals were open and, you don't worry about your kid dying. You just think that they're going to survive. Exactly. So we were always playing in the canal, and my brother got cut by something glass and his knee was open and, flayed open and bleeding. And my mom called my dad and he just brought home some sutures and stitched him up at home. I mean, that's just how you take care of it. Why would we need to go to the doctor?
My dad was an auto mechanic, and he taught. He was a teacher. He taught auto mechanics. He grew up like working on cars and stuff, so he knew how to do that. They called it industrial arts back then.
Yeah.
And so when we would get injured like that, our solution was mostly like, some mechanical fit, like a duct tape. Just put duct tape on it.
You know what? It probably worked too.
Yeah. Or tie it up. Here's here's put this on here and just tie it really tight.
Yeah.
And it worked. Yeah.
Baling twine, you know.
And we all, a clamp, we all survived.
Yeah, that's exactly me. Yeah. We just didn't go to the doctor.
No.
We just didn't do that.
I know. Yeah. Well, before we get really deep into this, can you just give me let's let our listeners know, give us a 30,000 foot of what you are today and what your practice consists of today.
Yep. So I am what I call a health-based dentist, and there's a story for how I got there. But I have a large dental practice, multi-specialty practice. So we see everybody from, the day you're born all the way till the day you die. And we take care of everything in between with sleep and TMJ and surgery and orthodontics and everything. But it's all focused on how does it improve your health. So that's really where I started. And as an outshoot from that, we started creating products that I couldn't find in the market. that I wanted to recommend to people, and I couldn't find them. And so I actually had a lot of influencers and people that were in those product businesses as patients. So I started asking them, well, how do I do this? And happened to ask one, do you want to partner on a couple of products? And that is really what took off with the product business, because we started that product together. Her company's Just Ingredients. I know you've talked with her before. Carlin, yep. And we started a dental care product line together, and that is what took basically that product company and took it to where it's at today. We've since added many things to that beyond just the line I do with her. But so really, I say I have 2 full-time jobs. I take care of the dental aspect, and then I have a product and information and education business along with books. So
okay, so what are your regular dental hours?
So actually, I had my last clinic day 2 weeks ago.
No more.
I was only seeing new patients for the last couple of years, because that's really my forte, is being able to look at somebody and saying, these are all the pieces you need to put together. But I've worked very hard to train other doctors to be able to do that, because now my next mission is to help change the definition of wellness, the way we define it and the way we pursue it globally. So that's my new mission. And so that will be products, that will be books, that will be information. And right now, pitching a show to a big network. So a lot of information, a lot of just getting out there and helping the world to live well.
Oh, how do you feel about leaving the dental practice?
It's been very surreal.
Yeah.
So I'm still there. I'm still there. I still do all the training. I still do all of that. But it has been a very odd thing. I've actually, just these last couple of weeks, even sometimes wake up in the morning and I think, I could do anything today. And I don't really quite know what to do. I don't know what to do with myself. And it's so odd, because it's been 28 years since I could say I could do that on a Wednesday. And it used to be, for 28 years, I've had to say, let me go check the schedule. I need to actually book that out about 4 months, because that's how far out I'm booked. And I have to make sure that, okay, what days am I working? Let's get on it. I don't have to do that anywhere. And it's so odd.
Yeah. Your dad's a dentist.
Yep.
You're in Emery County. How did that influence you as you were growing up? Did you have this sense early on, like the health services world is somewhere where you wanted to be, or did you just think, yeah, my dad's a cool dentist and I have other plans?
Well, I thought dentistry was gross because they didn't wear gloves and spit. So I thought it was really gross, actually.
Did they wear masks?
They did not. They did not wear gloves.
That's my recollection.
Masks.
No gloves, no masks.
So my dad would scrub blood out from underneath his fingernails after surgeries. So I did not want to be a dentist because I thought that was disgusting. But thankfully, they kind of joined the new age, new era, whatever, and started wearing gloves. And so I thought, well, maybe I could do this. But from early on in my schooling, I remember even like first grade, I was waiting for all of my classmates. If they weren't quite done with a book, then I would slow down. If they weren't done with a math assignment, I would slow down. And my mom pulled me aside, and I'll always remember this. And she said, Michelle, you don't need to wait for anybody. You don't need to wait for anybody. You go and do your thing. If you have abilities, you need to go, and that's what you're supposed to do. And so that was first grade. And from that point forward, I just kind of told everybody, well, just watch me. I'm not really kind of going to wait. And so I was always pushing the boundaries of things in school. My school was little, which actually was amazing because it gave me a lot of opportunities because I could be in everything. I could do everything. I even started, I was in every club, and I started 2 extras in my senior year in high school. It's just, I was always that kid. I drove my mom insane because she always had to do all the barbecues and, everything. And so that was just, and that's the way I still live my life. But I knew I had to do something that was extra, if that makes sense, that I could push myself and challenge myself to do. So as a senior in high school, I thought, yeah, this is medicine of some variety. So I went and asked every doctor in my neighborhood, would they be a dentist or a doctor? I asked every dentist in my neighborhood, would they be a dentist or a doctor? They all said, be a dentist.
Everyone?
The doctor said be a dentist. The dentist said be a dentist.
But why did they say that?
Because they said you're a woman, and if you actually want to have a family and children and a life, then be a dentist. The doctors all said your dad has a much better life than we do. We're on call. We have, overnight hours. We have all these things that are really challenging. And they said, if you really do want to have a family and be a mom and things as well as have this career, dentistry is the way to go. So I said, got it. So I went and started undergraduate school and finished 4 years and 2 years, and then went to dental school. So I actually graduated dental school at 23. And now I think back, I think,
in the world?
exactly, what was I doing?
Well, it's because your mom gave you that advice. Do you think
Exactly.
she regrets that? She was like,
Nah,
man,
think
when
she
I told Michelle.
But I think I do, because I graduated from here, graduate school in 23, and I thought, now I have to be old and responsible for the rest of my life.
Yes.
Like, when did all of those
Yes.
fun years, where did they all go? They just went to school.
Do you feel like that now? Like you're old and
Sometimes
responsible?
now. Yeah, I've had to be old and responsible a really, really, really long time. So, yes.
Tell me about this was growing up in Emory. Where did you go to undergrad?
BYU.
Okay.
Yep.
2 years.
Yep.
Did you finish in 2 years because you couldn't stand BYU?
No, it's
you sure?
because I wanted to see if I could. No, I wanted to see if I could.
That was it.
Yeah.
You just wanted to see if you could do it. Yeah. Do you have brothers and sisters?
I do. I have 4 younger brothers.
Oh.
Yep.
How was that? Why didn't we get into that? How was that growing up with 4 younger brothers?
Well, I was the second mom for sure, and the brother just underneath me, he and I are like oil and water. And so we fought terribly. In fact, he has scars on his face still from my rings, because that was my one weapon. So I would scratch his face with them. And, because I had to
All
stand
is
up for
fair.
myself.
Yeah.
I had to do this.
Yeah.
They burned down my treehouse.
I don't know the circumstance, but it sounds very reasonable to do that. Like, I may have done something like that.
Yeah, exactly. So yeah, it was a little contentious perhaps growing up, but 2 of them are orthodontists and one of them is an oral surgeon now. So
Oh, you're kidding. So they all went into the...
all but one. Yep.
And did they follow your lead or your dad's lead?
They all went to the exact schools I went to.
Oh, really?
Yep.
Did they finish undergrad in 2 years?
No.
So do you still hold that, like, holidays come around, you're like, 2-year graduate?
Well, no, because my brother who didn't go to dental school, he got a bachelor's degree. He always comes back and says, you don't even have a bachelor's degree.
Oh.
Because I didn't.
You see?
I didn't finish my bachelor's degree.
Yeah.
So yeah, he says, you don't have anything.
need to.
You don't got anything on me.
No.
You don't even have a bachelor's degree.
How many women were in dental school at that time?
Yeah, so there were very few. When I was applying, I had this undergraduate class, and I went to a dentist's office to shadow and learn more about it. They have you do that. Mm-hmm. And the dentist looked at me, and I was the only woman there, and he looked at me and he said, "What are you doing here?" I said, "Well, I'm going to be going to dental school." And I said, "No, girls don't do that. Girls go, like, you must be in the wrong class. They're hygienists, they're assistants, they're not dentists." Mm-hmm. And I said again, "Well, watch me. Here we go."
Oh, yeah.
So there were 13 women in my class of 86.
Uh-huh.
So it was definitely small numbers. We lost, I think, 2 women during the course of the 4 years of dental school. So we were down to 11 by the time I graduated. So there were not very many. It was slim pickings.
Did you love dental school?
Yes and no, both. The guys all said the only reason you're here is because they have quotas. And that's the reason that they accepted you. And I said again, okay. So I graduated second out of the 86. There was only one guy who had no life, and he beat me. But I actually had a life. I was married. And
You were married and in dental school?
yeah, I got married. I got married after my freshman year at BYU.
Did you? What?
Yeah. I don't do anything,
Oh my
slow way.
gosh! I know. I'm getting the. I understand the pattern here now.
It's a little.
One is like it started with your mom, and then like you have this internal drive, and then people keep saying to you, like, you're only here because, or you can't do this, and then it's like this.
Okay, then I have to prove
And
them
here
wrong.
we go.
And here
Did someone
we
say to
go.
you, you can't write a book because, here it is.
Well, that's my 6th book, actually. So that's number 6. But this is the first traditionally published book. So, yep.
The others self-published?
The other were self-published.
Gotcha.
Yep.
Well, we'll dig into the books at some
Yeah,
point.
yeah.
That was just a little prop.
So yeah, dental school was great, but it was very interesting for sure. Being a minority, but it felt very much like that. But it's all just about doing your best and showing them what you got, and that was great. I did love dental school, and I thought that that's what I would do forever. That I would just be a dentist, and that's all I would do, because that's what my dad's done. He's still practicing in his mid-70s. He works in a prison, in a maximum security prison, actually.
Where is he still down in?
He's in Arizona.
Oh, okay.
Yeah.
He works in a maximum.
Yeah.
Well,
why not?
I guess those guys need dental.
They need dental care
service
too.
too.
Yep.
Yeah.
So he's seen a lot of broken jaws when they get in prison fights and things like that. So anyway,
No offense. It feels like I need to have your dad on the podcast. Like, his life experience has to be.
They've been pretty interesting too. Yep.
Yeah.
Yep. So that's what I thought I would just do forever, is just be a dentist.
So,
But
okay. So you got in, you jumped into practice. Did you jump in with somebody, or did you start your own practice? How did you, did you go back to Emory County? Like,
no, there was not a lot of, actually, I married a boy from Emory County, so my husband's from there as well. But it's funny story. So he was at BYU also, but we didn't know each other. He was 3 years older. We never went to school together. We lived in different towns because the high school there covers like 45 square miles. You know, it's a huge draw to the one school.
Sure.
So he lived in another end of the county than I did. We didn't know each other. And so it's the way it works. So he was at BYU and went home on Christmas and was complaining to his dad, I don't know how to meet girls up there. And his dad, who was my math teacher in high school, said, well, I know this girl.
Yes, this is the part of the story that I wanted.
Yeah. Said, I know this girl. And he said, she's super safe because she has a 7-year plan. And I did. I had a 7-year plan. In 7 years, I was going to graduate from dental school, right? So he said, she has a 7-year plan. She's really safe. So you just ought to look her up. So this was back in the day where you could just call directory at the university and ask for a name, and they just hooked you to their phone. So we had a phone in my dorm room. And so he just called the directory and said, is there a listing for Michelle Coles? And they just connect him to my phone. I mean, you can't do that today.
No.
So, yeah. So it rang in my dorm room and I answered the phone and he didn't introduce himself. He said, hey, I just wondered, who was your favorite math teacher? So thankfully, I said his dad, because I actually had 2 great math teachers, one in junior high, 2 that I really loved. So thankfully, I said his dad, Mr. Bill, and he said, oh, well, I'm Mr. Bill's son. So we chatted for about an hour. And then he said, well, why don't we meet? You know, I said, all right, well, let's meet in my dorm. He said, well, why don't we meet at the north door? Because we didn't know each other. We didn't know what each other looked like. And you couldn't look each other on an Instagram back then.
No.
So I said, well, I don't know what you look like. How do we know where to meet? And he said, well, let's meet at the north door. And I said, well, which one is that? And he said, don't tell me you're one of those ditzy girls that doesn't know her directions.
Oh, man.
Now I do. But I didn't then.
But you didn't.
I did not. So he had to explain which door it was. So we met, we started dating, and we were engaged in a month.
Oh, my gosh.
So I was not safe after all.
No.
No.
Not at all.
No, I was not safe.
But that's worked out.
It's worked out. We've been married for, I can't even do the math now, 33 years.
Amazing.
So, yeah.
And he works in the practice?
Yes, he says he's officially retired and now golfing for his career.
Oh, man. I'd like to do that.
Exactly.
I'm terrible at golf. I want to be better at golf.
You need time.
I know.
That's the key to golf is time.
Is there any correlation between poor dental health and poor golf? Because if I just need to fix up
That's a great question. You know, there probably is some correlation there with some airway. We could do a cone beam CT scan, find out if you're getting enough air, if you can focus properly. Yes. I'm sure there's some things we could do.
I can see a new book project right there.
Exactly.
Okay. You go into practice and you're in Utah County?
Yeah, Utah County. I started working for another dentist. And within about 4 years, I had organized every closet in the office. I had completely created an entire team training manual. I had, because I just don't sit very well.
And you were a dentist.
Yeah, but if I had any time, then I had to go fix stuff. So I knew I had to have my own practice because I could only fix somebody else's practice so much. So then started a new practice. But my father that was when my mom decided she was done with living in the middle of nowhere. And my youngest brother had just graduated high school. And so they moved and we started the practice together.
Oh.
So it's the two of us that started it together.
Amazing.
Yeah.
How about that?
Yeah.
That is great. Okay. And you had an interesting experience for those first several years in dentistry and your gender.
Yeah. Yeah. Yep. So I was the only woman dentist in the county that I was practicing in for 10 years, actually. And I would go to meetings. And if you go to dental meetings where teams are there, there's a lot of women. Because if you think about it, the only guy in the office is the dentist, usually, right? Everybody else is women. So you go to a meeting that has everybody, dental assistants and receptionists, there's plenty of women. If you go to a meeting that's just dentists, there's no women, especially in Utah. So I would go to these meetings and people would ask me whose wife I was.
Yes. So how did you manage that experience? Was that a source of was that upsetting to you, or did you just...
My philosophy has always just been watch me, just and so I just usually laugh. And
You
say,
took it more like a challenge?
Exactly. Oh, just watch, no, do you know where our practice is? And so really it was interesting because early on in practice, we decided that we wanted to take everything that everybody hated about dentistry, and there's a lot. Like, the smells, the pain, the discomfort, there's like so many things people don't like about going to the dentist. I mean, people tell me I would rather have a baby. I'm like, I have had a baby, and that is better
than going to the dentist?
That can't be better. So we decided we were going to change everything. Every negative, we were going to change it up. So like the smells, we baked bread and cookies all day long. So it smelled great when you came into the dental office. We had massage chair pads on the chairs. We had makeup and hairspray to freshen up with after. Like we had all of these things to make it a better experience.
Gotcha. Way before your time.
Way before our time. And the cool thing is we actually had this was a cool story. We had some really cool recognition for this. We entered the Best of State competition and we won for like health businesses, something like that. But it put us into this category of all consumer services, merchandising and consumer services. So we were invited to this, back in the old days, it was televised. Nothing's televised anymore. So this televised event, downtown Salt Lake, where it was a dinner and awards ceremony. And so we thought we were just getting the award for that. We didn't know that there were big categories of all of the companies that were underneath merchandising and consumer services. So huge car dealerships, huge hotels, all of those things underneath the same category. And we were in that category as well. So they got up and there was, some fancy guy announcing the winner, and they announced us as the winner over all of these big hotels. And we were shocked. We didn't even know that it was a thing that we could win. So we went up, we got this huge, heavy statue, and my dad is terrified of talking like so he pushed me to the front. And he said, "You're talking.
You're up.
You're talking." But that was such a cool validation that we were doing something great.
Yeah.
That was appreciated.
Yeah, absolutely.
And so that's where I thought I would just say that we would just do this really cool dentistry and take really great care of people, but that's not what happened.
Win awards and stuff. Okay, before we get on to the that's not what happened section, what are all the terrible things about going to the dentist that you hear?
So smells.
So the smell. Okay, so what are the smells? Is it the smell when they're drilling out your tooth and you have that smell?
Well, I will always have the smell in my head because it's like when I would walk in my dad's office and it's that dentist office smell. So it's something called eugenol, which they use in dry sockets. Like if you have teeth that didn't heal right, it's like
an
this
actual thing.
It's like kind of this clovey smell mixed with like the smell of the stuff they use to polish teeth. And like, it's just...
It is a very distinct
kind of disinfectant
odor.
Smell, like all mixed up together.
Yeah.
And so you just like you walk in and it makes your teeth hurt when you smell it, Exactly. So smells.
Okay.
Obviously sounds. People hate that. The noise, that kind of thing. People don't like that.
How do you dampen that?
And noise canceling headphones and TVs. This was long before. I mean, everybody's doing TV now on the ceilings, but we were like the first people doing this.
The dentist I visit regularly. I'm there every 6 months.
Very good.
I don't get noise canceling headphones, and I don't have a TV.
We're getting gypped.
I have a hygienist who is very nice,
chatty,
conversational.
There you go.
But I would put that on my list of things I don't not enjoy, but are difficult at the dentist, is because I can't answer.
You can't talk back.
No. Yeah. You have all these things in your mouth, and how are you supposed? So that's an interesting experience.
Yeah.
But I still love my dentist.
That's awesome.
Even without the.
That's good.
Okay, so that's another thing.
Yep.
The sounds, and you have TVs, noise canceling headphones. What are some of the other
discomfort?
Things?
Obviously. So we work really hard to try to make. I mean, you can't get away with everything, but we try to do a very, very, very good job of. Completely painless shots and, those kinds of things. We give a lot of things aftercare wise that are going to help after, so that there's no pain after you go home, that kind of thing from the pain standpoint.
How do you manage? I mean, I think everybody has some level of anxiety going to the dentist. So how do you approach that?
Yeah, we have supplements that you take that are actually anti-anxiety. They're all natural supplements. You chew them up beforehand.
When you walk in?
And it literally puts your brain into this kind of delta wave pattern that's like this relaxation pattern.
Oh.
So yeah, like I said, we've looked at every single thing.
How about... Oh, go ahead.
Well,
Go ahead.
women complain that their hair is messed up and they look like all the makeup's like all washed off when we're done. So we had hairspray and makeup so you can refresh yourself when you leave. I mean, we have hot towels at the end. So when you get a hot towel like on a fancy restaurant or airplane, we have hot towels on a silver tray that we give to you when you're done, so you can freshen up with. And
I feel like I need a cool towel. I'm just sweating after a dental appointment. I need to
or that too.
wipe. Okay, what about the decor? I mean, walking into the dental office, I can picture it right now. Some generic prints,
smile pictures
on the wall, and a couple stacks of magazines in the waiting room, and standard kind of chairs and stuff, weird places to sit, and friendly receptionist. Okay, do you manage any of that differently?
Absolutely. So we have videos playing in the waiting room that are all about things people ask us questions about all the time. So that while you're sitting there, because we try not to make you wait, that's one of our goals too, that you shouldn't have a waiting room even at all. But, there's videos so that you can learn things when you're there. We don't have any magazines at all. We have books like my books people can read, all those things that are there as well. And no pictures of, fake smiles on the wall. It's usually nature-based in most of our practices because we're all kind of about, tapping into nature and all those kinds of things. And so you just feel like, it's like kind of like a nice hotel feeling when you walk in. Like, this feels like I'd like to stay here a little while.
Awesome. Okay. So you're changing the practice of dentistry with all of these experiences you're providing for your patients. That's amazing. And you're going through and you're going to be a dentist. You're just going to be a happy dentist for the rest of your life. In the midst of this, are you learning anything about what's happening in somebody's mouth is affecting their health? Are you noticing things like this as you're practicing?
Yes and no. I've always been a question asker. So I would see things like people had really worn off teeth in the front, on the bottom front.
I have that.
And so I can tell you what it's for. I can tell you what it's from actually right now. But so I would see that and people would ask, well, what's this from? And if I didn't know the answer, I would have to go find the answer. So I was always doing that. But it really wasn't related to overall health. It was still very focused on dentistry. You have worn out teeth. What do I do for your teeth? How can I help you prevent that and fix it? It's just really dental focused. And really, that's the way that the profession trains you to think. Dentistry, honestly, it's like your dad a little bit. It's a mechanic's job. It's really, you have a hole in your tooth and we clean it up and fill it up. It's mechanics work, and it's a lot of hands-on things that you do, but it's not a lot of going deeper into the whys about how things got to where they are at today. It's fixing you up and sending you on your way, and then you come back in 6 months again, and we do it again. It's just this big cycle. So that really wasn't even on my radar because it wasn't on the radar of dentists in general. Like no one was talking about that. Gotcha. So no, I wasn't thinking about that. But my own health took a serious turn.
You had an experience.
Yep. And that's what opened my eyes to all of it. Yeah. So I was busy practice, 4 young kids, running around, barely keeping our head above the water, but it was going and doing what we needed to do. It was all good.
Is your husband working in the practice at this point? Okay.
Yep. So my husband was working. He was doing all the finances, all the accounting, all the back work, all the backside of things. He's actually an engineer. And I have twins, and when my twins, they're my oldest, when they were about 2 years old, he was working, he was consulting engineer, traveling all over the place, and I had this busy practice. We had twin toddlers. We just said, something's got to give here. And the dental practice, we still, we owed $1 million on this thing, and that was, 20 years ago. And when you basically, you go where the debt is, and you figure, okay, we got to make that work. And so he left his engineering job and came to take care of all the back end pieces so that I could be the front end, face of the practice. And he's just stayed there. And thankfully he's stayed there because he's taken on a lot of roles, and he's been the flexible one in our relationship, with kids. You have to have somebody that can drop everything and go and take an assignment to the kid when they forgot it or their lunch or whatever. And I couldn't do that for so many years. I couldn't do that. So somebody had to be able to do that. So he has been a phenomenal support for me.
Gotcha.
Yep. He's been awesome. So yeah, I started not feeling well. And you just assume it's because of stress. And because, maybe we're eating too many frozen burritos,
Wait, is that a thing? Can you eat too many frozen burritos?
I don't know. We thought it might be the problem,
Man,
and Hamburger Helper,
But isn't there I always am a little sad when when you figure out this isn't so healthy for you.
It is a little sad, actually. I still can remember the taste of the frozen burrito. I still can remember it. Those really deep-seated ones are the corn dog that came from the Schwanzmann growing up that you dip in the mixture between ketchup and mustard. I can still taste it. Mm-hmm. I don't eat it anymore.
No, because it's
still in my brain.
It's so terrible. And that's a whole, we could have a whole other discussion about that, about as a society, how did we get to that point where we were told, you can go ahead, eat this.
Yeah, Schwanzmann corn dogs, they're as good as it gets, man.
You're going to be fine. Yeah, eat this bag of chips or whatever. Yeah. Anyway.
Yeah.
Okay.
Yeah.
So you're not feeling good. Maybe it's stress. You have a busy life. You have kids. You're doing all the things.
Yep.
And you're watch me all the time. So you're taking on
doing too many things.
Too many.
And,
Yeah, and you're not feeling great.
Yep.
Okay.
Yep. So it wasn't feeling well at all. I was having gut issues. It got to the point where I couldn't even drink water without pain sometimes. So it was really bad. I got a diagnosis of IBS, irritable, which means nothing.
Yeah,
it means great, suffered, but at least you have a name now for your suffering.
Yeah.
That was worthless. I started the white diet because I heard IBS, that's what you should do. And so it was everything white. So I was living on white angel food cake. That was, I'm sure, helpful.
Yum.
Mm-hmm, exactly. It was very delicious, but it didn't help with it all, with anything.
So is the white diet white proteins?
It was everything white.
Everything
white.
Yeah. That's such an that's actually a diet.
Yeah. But it's certainly nothing I would do now. So, I tried that. It didn't work. I went to doctor after doctor because my brain was just slipping. And I've always had a good memory, but I wasn't able to complete sentences.
What?
I wasn't able to remember my patient's name from room to room. It was bad. And it used to be that in the olden days when we had actual film x-rays, the old kind of the stick in your mouth, we'd get, dip them in the stuff and we'd get a film out. We would keep them in charts. And so sometimes when they were carrying charts from room to room, they would fall out of the chart. And so we would have an x-ray on the ground that nobody knew who it belonged to. They would be able to bring it to me and I could tell them who it was.
No way.
Yeah, because I could just remember. I have a real good, my visual memory is really good. I couldn't remember anything.
Whoa.
So we knew, it was such a drastic change that it was very apparent something was wrong. But the big one was my hands. I had such painful numbness, I couldn't sleep I couldn't sleep at night. I'd be up all night long because as soon as I would lay down, my hands would go so numb and it would be so painful, I would instantly be back up again. So I was sleeping sitting up. I was wearing braces on my hands and my arm. It was absolute misery. And I couldn't blow dry my hair. I couldn't put on mascara. I couldn't even hold my instruments. My dexterity was almost down to nothing. So again, doctors, I was going to chiropractors 2 and 3 times a week. I was getting massages 2 and 3 times a week because they all said, it's just because you're doing all this work and it's straining your muscles up here. And, and so of course I'm trying everything. I'm getting injections, anything I could do and nothing was getting better. So I actually put the practice for sale and we didn't know what we were going to do. Because this is my husband's job too. We had debt on the practice, 4 young kids. This is what we've put everything into. And this is I was 36 years old.
Wow.
So we didn't know what we were going to do.
Oh my gosh, that's unbelievable.
Yeah. And had no answers.
And so where did you find how did you get to the solution? Who came up and said, this is what's happening. Mm-hmm. This is what you're suffering from. And here's what you do.
Yep. So I had been starting to study nutrition because of my own gut problems. So I'd figured out that frozen burritos and corn dogs, unfortunately, weren't the best thing for my diet. I know it was such a sad day, and we threw away all of our food. My kids were very sad. In fact, I'll always remember, this is one of my favorite stories. We went into one of those health food stores. We didn't even really know what they were. Mm-hmm. And you know how they smell really weird?
Yeah.
Like dirt. Kind of, and
it's a unique
that
smell,
funk smell. And so we didn't know what to do, and we were just wandering up and down the aisles, and we just thought, well, organic must mean it's better for us. So if it says organic on the box, it must be better. Yeah. So we found organic gummy bears, and our kids were super mad because we'd just thrown away all their food. So we bought a case of organic gummy bears. So that was
the compromise.
That was where my nutrition level was. My nutrition education was at that level at that point. But I started learning more that maybe even organic gummy bears weren't the best for us. Mm-hmm. So I heard of this doctor out in Pennsylvania that had a nutritionist in his practice. So I called him and I said, well, maybe I could just be a nutritionist in my practice. Maybe I could just help people with their diet because I don't need to hold instruments to be able to do that. So I started talking to him about this possibility and he said, your symptoms sound a lot like mine. Have you ever looked into the possibility of mercury poisoning? And I said, well, no, in first year of dental school, we're told that silver fillings are 50% mercury. Mm-hmm. So I've been told that. But I'd also been told that if I told anyone it affected their health, I would lose my license. So I said, I don't have any fillings and I know they're completely safe. And he said, it's not the fillings you have. It's the ones you've been drilling out without any protection for the last decade. Maybe it's worth getting tested. And he was right. I tested everything else, but I hadn't tested that. So I said, well, you're right. I'll get tested. So I got tested and that's what it was. Mercury levels off the charts.
Wow. How do they test? Is that a blood test? How do they test?
It was, it's something you have to provoke because mercury goes and hides in your brain and your kidneys and other places. So you actually have to take a thing to pull it out of your tissues first, and then you do a urine test. So you can't just go and pee in a cup and expect to get a mercury level because it goes and hides. It's not that readily available. So you have to go and provoke it and get it out, and then you test it.
So what do you have to take?
It's called EDTA. There's a couple of things that pull it from your tissues.
Wow.
And then you go and test it. So, yep.
And so test results came back. Was it this guy who did the test, or you went to a
No,
medical
went to
facility?
a different doctor, yeah.
Okay. So you got the test back, and at that point, did you feel like relief or dread, or what were you feeling when you determined?
Mixture of relief, because now finally I have an answer, and furious. I seriously have been in this profession for this long, and I've been told it's safe, and I've never been told that this could make me sick. And this is the craziest statistic, and I never could understand it. Dentists have a high rate of suicide, and I've actually had 2 classmates of mine commit suicide. Okay, right, exactly. And as I've tried to explain this, I've asked people, why dental? Why would we have a higher rate of suicide? Well, it's a very stressful career. I'm sorry, but I can think of a few other careers that are probably more stressful than dentistry, okay?
Yeah.
Air traffic controller, perhaps,
Yeah, shipping and logistics.
Shipping logistics, perhaps.
Very.
It's true, though.
Well, true.
So it doesn't make sense, but it does when you realize that mercury is a neurotoxin and it literally fries your brain and your nerves. So all of a sudden, it made sense that dentists are literally going crazy because we're breathing in mercury as we're drilling fillings out of people's mouths.
Okay. I have a question that came up as you were talking about all of this. I don't know if we really want to go down this path. But how, the industry or somebody in the industry had to know this was occurring for a long period of time. So is there, conspiracy theory, whatever, is there some massive cover-up associated with, because people were told these are the fillings that you use and this is safe, and lots of people. I don't have any more metal fillings. Well, thank goodness.
Silver fillings, yeah.
Yeah.
Yeah, the 50% mercury. Still today. People say, oh, no, they don't put them in anymore, right? Oh, yeah, they do. Everywhere, all over the country right now, they're being placed in people's mouths.
Oh, my gosh.
Still being placed. They've been banned in Europe and other countries.
Okay.
But so what's the cover-up, right?
Yeah.
What's this all about?
I have another question. Okay, but let's get back to the cover-up in a second.
We'll go back.
But, okay, so if I have a silver filling in my mouth, then it's contained, right? It doesn't affect me.
Incorrect. That mercury is being released from your filling 24/7. Research, now I will not lose my license to tell you this because research has shown this is true. So it is being released 24/7.
So it's not just exposed when you're drilling it out and it becomes airborne or whatever. It's, if you have a silver filling, it's probably a good idea to go.
Yep. Because it's even more exposure when you are using it. So when you're chewing it, and particularly when you're cycling hot to cold. So you drink some hot soup, and there you eat some hot soup, and then you drink a cold drink. That thermocycling will lead to more mercury release as well.
Oh my God.
So, but here's the caveat. You have to remove it safely, because that's why I got sick, because I was removing them unsafely. All that mercury was just released into the air. That's the biggest exposure you're ever going to get, is during the removal process. So there's an entire protocol. That's how I started to get well. As my doctor said, you can't get this out if you keep putting it in. Like, you got to figure out, if you're going to keep doing this job, how to do it in a way that you don't get more mercury in you. And that's what I had to figure out. And I found out there are ways. There's an entire protocol that we follow now where everything's covered. Your whole body as a patient, your whole body's covered, your nose is covered, your mouth has a rubber dam. We have a giant vacuum by your chin. All of this because you get more mercury during that removal than any other time. So I always tell people, leave them in your mouth unless you're removing them safely.
Oh, I'm certain that mine weren't removed safely.
I'm certain they weren't either, because if you have somebody that walks in a hazmat suit, then they're safe, because that's what we do now. And that's really what patients, when I started removing them this way, patients were like, what's going on here?
Wow.
And so then I started being able to share my story. But why is this not more widely known?
Yeah. Are we back to the cover-up?
We're back to the cover-up.
Okay.
I always assume positive intent. Okay. I always assume positive intent. But this is interesting because clear back in the 1800s, when these fillings were invented, barbers did dentistry. Barbers and doctors. There was no such thing as a dentist. So barbers would lean you back, you'd do a cut and a shave, and they'd fill a tooth or yank a tooth, right? Yanking teeth is not easy. And imagine doing it with no anesthetic, no nothing. Like, it would have been really hard to pull teeth. So they figured out they can mix mercury, liquid mercury, with silver shavings, and they could make this kind of putty stuff and then shove it in a tooth and it would turn hard. So it was fabulous because they could then save teeth and not have to pull all these teeth. The doctor said, we're a little worried about this because at the time, the other use for mercury was in hat making. People would take liquid mercury, would rub it on fur. It's called kerating or felting, and it would turn it into felt to make the felt hats, right? So the felt hats, that's how they make them. They rub fur with mercury. The hat makers were going mad. They literally were losing their minds. They were shaking so bad they couldn't feed themselves. This is where the term Mad Hatter comes from.
Gosh, I love these. Are my favorite things to learn.
Yes, this is the Mad Hatter origin story. So the doctor said, we don't think it's necessarily a good thing to be putting mercury in people's bodies because we know it's made these young men who are making hats mad.
Wow.
So the barber said, we don't really care. It's cheap and easy, and we're going to keep doing it. So
and it's just so small.
It's just so small. So the fillings came to the United States full of mercury. Why are they still here today? So the American Dental Association is paid by dentists. All right? You don't pay dues to the American Dental Association. I do. Every dentist pays dues to the American Dental Association. Their job is to keep the profession safe and to keep the profession safe for customers, for patients as well. Obviously, they want to make sure that dentists are taking good care of people, but also the dentists are also safe as well in the profession. If the United States were to say that these fillings are dangerous to health and ban them, because we live in such a litigious society, every dentist that has placed or has removed a mercury filling would probably be under a class action lawsuit.
There's no doubt.
There's no doubt. So the American Dental Association can never do this. Neither can the FDA. Neither can any regulatory agency, because it will set off a firestorm. So that's why I share, because I can say this. They can't.
Yeah.
So again, I assume positive, intent. I'm not saying this is a huge cover-up and conspiracy. You can say that as well. But it's just that it's the way it has to work in our country. So that's why I share, because I can tell you.
Wow. Well, that's fascinating.
Isn't it?
Yes, it is.
Yep.
Okay, so now that you've determined what the issue is, what is the recovery? What is the treatment? What is the recovery process? How long does it take? And how quickly did you find yourself back to normal?
Yeah, I took about 8 years to feel like my brain was back.
Wow.
Mercury doesn't leave kindly or easily.
It just likes to hang around.
It just likes to hang around. So I had to do a very slow detox using things like chlorella, which is like a green food, like chlorophyll, and I had to do a very slow detox, getting it out of my system. But it was really key that I didn't keep putting it in. So that's why I started doing these new protocols for me. But that was the interesting process, because people would start to say things like, my sister might be interested in that. She's kind of not feeling great. Or my doctor's been talking to me about some things like this. I bet they'd be interested in this. So all of a sudden, people started coming and asking me more questions. And doctors started asking me questions like, well, what's the truth about fluoride? What do you really know about this? And how about root canals? Like, I've heard that there's maybe concern here. These were all things I knew nothing about other than my dental school training that fluoride's completely safe. It's the only way to prevent tooth decay. Root canals are great. No problems ever. That's all I knew. But they were bringing these questions to me. And again, I just have to go find an answer if I don't have one. And I started finding out that the things that I'd been trained and taught forever weren't necessarily all true. And there was a huge correlation between overall health and dental health that I had no clue about. And that's what completely changed my practice, because I started finding these answers, treating things in a different way, looking at everything in the mouth in the view or scope of how does this affect overall health? And our entire practice started growing because all of a sudden people said, this is the kind of dentistry that I want to have. I want to make sure that nothing I'm doing is going to be taking me down the wrong road here. And vice versa. I have been sick for forever. I've seen every doctor, and my story, I've seen every doctor, no answers. Maybe it's in my mouth. And I have since found out that 60 to 80% of chronic disease is related to the mouth. So we get referrals from doctors all over the country saying, you need to go find out if the reason we cannot fix what's wrong with you actually has an origin in your mouth somewhere.
Wow. At what point would you say that became your mission, your new mission in life?
Pretty much the time I found out that's what made me sick. Now I was...
And you started getting people who were saying, I have this issue and maybe it's related. And then you started finding the answers.
Yep. So I went back to school, became a naturopath, and I just decided, okay, I've got to have the answers.
Okay. Tell me about that. What did you call it? A naturopath?
Naturopath. Yeah, it's called a traditional naturopath. So I went and started learning all about things that you'd think your dentist or your doctor would know, but we don't. We're not trained about nutrition. We're not trained about how the body digests food and about how these symptoms show up elsewhere in the body. We're not trained that. We're trained our very specific, isolated little specialty. We're not trained about how it all connects together. So I went back to school to learn how it connects, and I had to go outside of traditional mainstream medicine to be able to find those answers. It's been very interesting because now I'm training other dentists the things that I learned, saving them a lot of time and a lot of energy and effort to be able to actually teach them this is what you need to know. But it was an interesting journey for me.
How long have you been on this side of the dental practice, like the living well side of the dental
about
practice?
15 years.
And what has adoption been like with other dental practices?
So thankfully, I was very accustomed to doing what I felt like was right, regardless of what other people thought. Because first of all, I only knew to call myself holistic. And anytime you use the word holistic, people think you're crazy. And they think that you're going to have tie-dyed shirts and you're going to be like burning incense. And
I wasn't thinking that, but I did think like, you would come into the room, I'd be in the chair, and you'd have like maybe jingly things and a long flow.
And like chanting or,
and the incense burning and
exactly
all of that.
But
when you say holistic.
So holistic comes with its own baggage. It's stereotypes, where they think you're crazy. And not only that, they, inside of the profession, they think, in fact, people comment on things all the time. And it's quite fascinating because these brothers of mine that are also in the profession, they're on other forums. I really have now arrived because now other dentists are commenting about me on their forums. I'm always so excited to hear that. Not positively, of course, but it's okay because I feel like, I've arrived now that they actually am part of the conversation. But yeah, it's all a lot of disdain. In fact, there was a really interesting disdain. Like, they're just like, she does not follow science. There is nothing about, she's just going on feelings all the time. But it's interesting because when you come to my practice, people come and they go, whoa, this is like the most technologically advanced dental practice I've ever been in. Exactly, because I have to prove everything I say and do by science. Your dentist, no one's asking him what research study backs what he's doing today, but everybody asks me. So I have to stay up to the latest in research on everything. So it's completely different. But there was one experience that stands out. I had gone to the end of a dental continuum, and when you're doing continuing education, it's intense and it's expensive. This is stuff you do after you've left school. So it was 9 different weekends. Each weekend is about $6,000. So you can start doing the math about how much money I've spent just for the courses. Then you factor in the time away from practice, the travel expenses, all of the above. So I'm in this at least $100,000 at this point, okay? I'm at the last day of the last course. So anybody that's there has also put that much effort. That means they're going to be at the top of their, profession. We're sitting at the lunch table, and one of the guys at the lunch table starts to tell a story about a dentist in his building that wears a hazmat suit to take out mercury fillings. And they start to laugh. The whole table starts to laugh and make fun of it, okay? So I'm sitting there and I'm thinking, do I say something? Do I not? But I always say something. But what I say is...
It would have been really interesting if you didn't say something.
Exactly. But what I said is, you know what? Can I share my story with you? Because no one can tell me my story's wrong. So I shared my story. They were all very embarrassed and apologetic. And I said, no, that's not the reason I shared my story. The reason I shared my story is because I never want you or any of the patients you care for to be in the exact same situation that I was in. That's why I shared. So that is the response that I get in the profession, is that she knows nothing. She's going on feelings. None of this is science-backed. And, she's just all this woo-woo stuff. None of it's actually, true dentistry or true medicine, which is completely incorrect. Anyone who's visited us knows that that's completely incorrect.
So that's really interesting. Okay, so we're a shipping and logistics company. The way that we try to serve our customers is we provide data. Like, we provide data to our customers so they can make good shipping decisions. Okay. What does your data show in your practice with your patients in this the new way of practicing dentistry?
Yeah, the data is incredible. So we actually do track data. There's an area where oftentimes when wisdom teeth or other teeth are removed, but we often find it in wisdom teeth areas. When wisdom teeth are removed, because it's done in a growing body, somebody's late teenage years, they're not necessarily eating the best. Their nutrients are needed elsewhere. And they don't necessarily take great care of themselves during that healing process. They're going out playing basketball the next day, whatever. So we find that a lot of times those areas didn't heal properly, which leads to this dead zone in the jawbone that affects their energy systems, their adrenals, their thyroid. So you asked if there's anything performance-wise that could be related. This is huge. I see so many people who say, I cannot get past 4 p.m. I just have no energy. We go and we find these dead zones that are leading to chronic inflammation in the body. So again, people can go...
I'm certain I have this.
You very well may. So we take a cone beam CT scan and we find it. But we track and see our results because everybody just says, you're just crazy. And I say, well, first of all, no, because I can show you the scan and exactly what we find. And then we can show you post scans. We check it a year out. But we send a survey to all of the patients that have had this procedure done at 3 months out. And we say, first of all, what were you trying to alleviate symptom-wise? Was it minor, major? Where were you landing? Did it alleviate the symptoms? And would you recommend this to other people? We're currently running at 89% alleviated symptoms and would recommend it to other people. So that's our data saying this makes an enormous difference in people's lives.
How do you treat that?
We go in and we open it up and we clean it out. And we fill it up with stem cells.
Really?
Yeah.
Wow. Well, I might.
You're like, I'm less excited now.
No, I'm like, I might be making an appointment.
Exactly. Yeah. Because there are so many little tweaks like that we find that affect overall health. So now I no longer call myself a holistic dentist. I now call myself a health-based dentist because it's all about health. How can I improve your health and help you live well?
I kind of like the visual, though, of the holistic dentist with all this stuff walking into. That'd be a completely different approach.
Yes, it would be. No, I even make my doctors wear a shirt and tie. They don't like me, but I really want to look like we got our junk together,
Listen, side note, I appreciate being well-dressed in the professional setting.
I do too.
I think it's important.
Yeah.
Call me old school.
Like sloppy scrubs doesn't really engender a lot of confidence in my mind.
Not at all. I mean, talk about sitting in the chair at a dentist office. You already have some anxiety built in, and some guy walks in that looks like...
a slob.
Right. That, exactly.
Yeah, I don't do it, so yep.
Well, I appreciate that. That's awesome. Okay, so you've been practicing this way 15 years now, and you said 60 to 80% of, I'm going to mess this all up, health issues have some foundation in your mouth.
Yep.
Is that correct?
Yeah.
And what kind of, well, I'll just throw some things out at you. So You said inflammation. Inflammation in the body?
Yep, huge. Like sore joints, so arthritis, just overall heart disease, high blood pressure, high cholesterol.
High cholesterol related to issues in your mouth?
Yeah, I had this lady. Her cholesterol was over 300, just crazy high. Doctor had done everything to get it down, couldn't do it. They said, go check out your mouth. We went, did the cone beam CT scan, found she had 3 infected root canal teeth. So root canals are silent because they don't have the nerve anymore.
Oh.
So you don't feel it when they're infected. I will literally find quarter-size holes in people's jawbone with oozing infections that they have no symptoms for. So we found this in her. The reason I know the end of the story is because I saw her husband as a new patient about 3 months down the road, and she said, I have to tell you what happened. She said, I got my teeth out. I got those 3 teeth removed, all the infection cleaned up. She said, I just happened to have a blood draw for another cholesterol test like the following week. She said, I went and got it done the following week. It dropped 90 points. And the only thing I did was getting rid of those infected teeth.
Whoa. So
cholesterol is an insulator. If it's there and it's high, it means your body is insulating itself from something. It's the symptom. So that's my new book is all about this. The symptoms that we have are the signals our cells give us that something's wrong. But in our modern medical world, we just cover them up. We have a headache, we take ibuprofen. Instead of saying, why do I have a headache? What are my cells trying to tell me right now? So high cholesterol is just your body saying, there's something big, bad, and ugly in your body that I'm trying to protect you from. So go figure it out. Instead of just lowering the cholesterol. If you lower the cholesterol, you've now lowered your body's ability to protect you from whatever's wrong.
Interesting.
So you've done the wrong thing. So this is all about paying attention to what your cells are telling you and giving them what they need.
Okay, what about poor sleep? I think that's something
Huge.
people deal with all the time, poor sleep. And
Huge, yep.
Can't ever figure it out.
Largely related. So your worn front teeth is because you are bringing your bottom jaw forward. If everybody now listening knows this.
I know, it's terrible.
You bring your bottom jaw forward
front teeth
to get more air. So yours is a structural issue, most likely. Because the way your mouth grew, it didn't allow enough room for tongue, tissue, teeth, everything to fit. You probably had crooked teeth, had braces maybe early on, maybe still do.
I'm the only kid in my family who didn't get, well, there's only 3 of us. So. I was the one who didn't get braces in our family.
Yeah. So everything doesn't fit in your mouth. So it all has to spill back into where your air should come. So to accommodate for this, you bring your bottom jaw forward. But as soon as you engage a muscle and bring your bottom jaw forward, it takes you out of deep sleep. So you always run in just kind of light sleep, never fully refreshed, never fully regenerating at nighttime, because you cannot do that unless you're in the deepest layer of sleep.
Can I fix that?
Yes.
That's fixable?
Absolutely.
Do I have to have surgery?
Nope. We make more space in your mouth. We do the braces you never got when you were a teenager, but we do it clear braces. So nobody even knows you're doing it.
I'm over 50 years old.
We do this in 80-year-olds.
I can't have braces.
You can. I promise you. We just do the clear ones. Nobody even knows it's happening. You can take them out in meetings.
I can't. What?
Yeah, it's an Invisalign. You take them out when you don't want them in. You wear them at nighttime.
This is my biggest question about braces.
Yes.
Well, 2. These are my 2 biggest questions about having braces. Can I chew gum? And can I still eat popcorn?
Yes and yes, if you take them out when you do it.
Oh, okay. Phew. Well, who knows? Maybe.
Yeah, because if you really want to breathe. So a lot of times, again, sleep issues are just Band-Aided because people slap a sleep app on you. Sleep app fixes nothing.
Or that...
Or an appliance that holds your jaw forward, which actually changes your jaw and ruins your jaw after about 4 years, research shows.
How do you feel about mouth tape?
Mouth tape.
Sleeping.
My husband sleeps with mouth tape every single night because his lips don't stay together. Why do they not stay together? Because his mouth did not grow in a way that allowed more room in his nose. So what do we do to fix it? So the mouth tape, the need for it is, it's a great solution, but it's a Band-Aid. It doesn't fix anything. So we say use this as a solution now while we're actually fixing the root cause.
And what is the root cause?
Making your mouth bigger so there's enough room in your mouth for everything to fit. So and all of a sudden you can breathe through your nose and mouth like you should.
Are you doing that for him? Are you making his mouth bigger?
Yes. Yep. Clear braces. It's easy.
Oh, if everything comes back to clear braces, we're going to have to end this immediately.
A lot of times breathing and airway issues do, or infections. So again, like we said, those wisdom tooth infections, if they're there, they create swelling in the mouth and you can't breathe by it.
Why do we have wisdom teeth? Like, everybody gets their wisdom teeth taken out. Why did wisdom teeth grow in the first place?
So if you look back at schools 200 years ago, they all fit. The problem is that we're malnourished. So I know this because my son, who we adopted at 2.5, his mouth was literally the size of like a little mouse. It just did not fit. And he had been born really premature, super malnourished. The top jaw is the first bone affected when we don't get enough nutrients. All of our food, those frozen burritos and corn dogs, unfortunately, do not deliver the nutrients that we need for proper bone development. So all of our mouths are too small.
Whoa.
200 years ago, they had all of their teeth. They were straight, and they had all 32 teeth that fit just fine.
You know what one person told me? I think he was a dentist or some medical professional. He said that the reason we had to take wisdom teeth out is because our ancestors, cave people, were eating a lot of rough food and rocks got mixed in and their teeth ground down. And so they just had more space to fit.
It's not completely wrong.
Teeth.
They used a lot more foods like raw vegetables and, all of that. But it's a nutrient level thing as well.
Okay.
Yeah.
So there's a little truth in that.
Yeah.
I can still tell people that.
Yeah.
We just didn't eat rocks.
Yeah. So those nutrients are actually the thing that create tooth decay, that create all of these things. Like everything's just sugar. No, it's nutrients. And that is the only connection that we have with you in shipping. It's the products that we ship for this reason.
Absolutely. Okay, I don't want to. I still have a couple questions about the mouth.
We can stay here as long as you want. I'm just sure people are listening going, wow.
No, you know what happens? These guys are so good, Caleb and Solomon. And actually, my daughter is on this marketing team as well. But we're going to get so many good clips out of this. And I think that people almost...
Well, they're going to want to know this too.
They almost enjoy watching the clips more than they enjoy watching the full length of it.
Yep.
I do both. But anyway, okay, so this relation between the health of your mouth and overall body health. Is there a correlation between mouth health and athletic performance?
Yes, especially when we're talking about airway. So if you think about it, when you are lifting weights at the gym or when you are running really hard, well, two actually different things. So if you're lifting weights at the gym, a lot of times people will say, well, I only really squeeze my teeth when I'm lifting weights. And I say, well, the reason you're doing that is because you need more oxygen. So when you're squeezing your teeth, what it does is it tightens up all of the muscles in the airway and allows more oxygen to get from the nose or the nose down to the lungs. So you're increasing your oxygen capacity. Oftentimes when people are running, if you watch them, they're not running with their mouth closed. They're running with their mouth open.
Always.
Why? Because they need more oxygen.
Yeah.
Right. And the noses aren't capable of getting the oxygen they need. So all of that athletic performance requires more oxygen. So when we do this, it's called a cone beam CT scan. It's a head-specific CT scan. We do it in the office. It's not like the big old, lay-down kinds in the hospital, anything like that. It shows the head in 3 dimensions. I can see exactly the tube you're breathing through. And is anything else crowding that out? Is your tongue too far back because there's not room up front for it? Is there swelling in the tissue because you have infections in your mouth somewhere? Did everything kind of get stuck in there over a lot of years and now it's all stretched out and you can't breathe by it anymore? All of these things we can treat. We can use lasers to shrink up the tissue. Like we can do all of this. So when we make more space for air to get to your lungs, this is really actually interesting. Inside of every single cell, there is an energy, it's basically like an energy power plant. The way it works is it takes a molecule of fuel, and this is a little misknown or misunderstood thing as well. Carbohydrates are actually your cell's preferred energy source. The cells cannot use protein for energy. They only use it in times of sort of starvation. So all this huge protein rage that we all need all this protein, you're building muscles, you're making your chemical reactions grow better, but you're not increasing energy because cells do not use protein for energy. So you take a molecule of fuel, either carbohydrates or fats, and it combines with oxygen to make batteries. So that's your energy for performance, okay?
Gotcha.
If you have fuel with no oxygen, you can make 2 batteries. If you have fuel plus oxygen, you make 32 batteries with the same amount of fuel. So it's like running on 2 miles an hour versus 32 miles an hour. Oxygen is the difference in performance. So if you can increase your oxygen levels, you will increase the rate every cell is able to deliver you energy.
So John Belushi did this skit on Saturday Night Live once when he was in...
This is a good detour.
Where he was He was an Olympic runner. He was a track star. And the key to his athletic performance was little chocolate donuts. Do you remember this? Wait, so are you telling me, like, isn't that a carbohydrate?
Carbohydrate.
Are you telling me that there's truth in the little chocolate donut theory of increasing athletic performance?
I'm sure John Belushi's chocolate was better than chocolate today, but yes.
Is there healthy chocolate?
There is, actually.
way?
Cacao's amazing for you. It has all sorts of antioxidants in it, which help to deal with like damage in the cells.
How bad is sugar?
Depends. That is what a carbohydrate is. It's sugar. But the problem is when you get a simple sugar, when you eat a simple sugar. So that's white sugar, right? It's a simple sugar. It is burned quickly by your cells. It has to secrete insulin. Insulin grabs it and goes, all right, let's go put it into our cell. You do that enough, and all of a sudden the body's like crying wolf. It's like, I don't think I need to send that insulin out anymore. They certainly couldn't be eating that much sugar. This is type 2 diabetes, when the body stops responding to the sugar in the same way. The insulin isn't as available. And so the body, now we have high sugar levels in the body because the body's not taking it in and utilizing it. It's different when you talk about sugar, maybe a donut perhaps, versus an apple. Apples have a ton of sugar, but it's a complex carbohydrate, which means it's bound by the fiber inside of that apple. It's bound by all the other nutrients in that apple. So you eat an apple, you're getting a lot of sugar that your body needs for energy, but it's slow dosed because it's releasing from that fiber slowly as the gut's absorbing it. And that is the most beautiful form of food you could ever feed your body, is those complex carbohydrates that your body utilizes for fuel, but it doesn't spike the insulin. It doesn't start throwing off all the way the body deals with blood sugar. It doesn't change that. It slowly gives you the energy you need. So I tell people 2 p.m., what should you be eating? An apple and a couple of dates. It is the best energy food you could ever have. Not a Red Bull, not a coffee. It should be an apple and a couple of dates at about 2 p.m. And you, along with electrolytes actually carry electrons to all your cells, which are the currency of the energy. So electrolytes, an electrolyte drink, an apple and a couple dates, and you will feel
That's your afternoon snack?
You will feel like you are on. Yeah, you'll be on again for the next 6 hours. No problem.
It's so much easier to go into the cupboard.
Yes, it is.
And grab. Okay, so let me ask you this: if that's your option, let's just say you don't have an apple in a couple of days. This sounds amazing, and an electrolyte drink, but you have a selection of almonds and beef. I'm going through our cabinets and beef jerky,
thinking in your mind,
and
yes,
chips and crackers and Hostess donuts. And there's some protein bars. Okay. So what are you choosing for your afternoon? And you have energy drinks and coffee and soda.
Yep.
Okay. Okay.
So you have to really talk about what does each thing do to your cells, right? So your cells loves carbohydrates. So it might seem like that chips is a great option, right? It's going to give you a fast boost of energy. You're going to feel better, but you're going to crash because it didn't last very long because it was some simple sugar. It was burned too fast, right? Versus an apple, right? You're going to just burn it too quickly. If you go to the protein bar, does it have carbohydrates in it? It does. That's actually a great choice because it's going to be a slower burn carbohydrate because it's connected with that protein in there. There's some fats in there, so it's going to be a slower choice or a slower burn. Almonds, the same. There's going to be some nice fats in there. There's also some carbohydrates in almonds. So that's, again, a good energy burn. You're wanting to avoid the fast burn, which is going to be a soda, a chip, a pretzel. Those are your fast burns. They're going to give you fast energy, but it's not going to last. So what do you want it to actually last longer than about an hour? The other thing that's really interesting, and this is a concept that I love to talk about, is something called the apostat. So in your house, there's a thermostat that it, flips on your heater if it's too cold, flips on the AC if it's too hot. We also have something in the hypothalamus in our brain that turns on our hunger mechanism, our appetite, based on, we think it's the amount of food, but it's not true. It's actually the nutrient levels in the body.
When you say we think, are you saying the medical
I think people in general.
Okay, that makes sense to me.
Just people in general.
Because that's what I think.
Yeah, think that it's the amount of food that you eat, right? That turns on your hunger or not.
Okay.
Yeah, I didn't eat enough food today, I'm hungry. But that's not the way this works.
Or what about this? I had a really hard workout this morning. I'm hungry.
Okay. So if you are hungry, your apostat is on. It says, all right, hunger is on. What it's looking for is nutrients. It's not looking for calories. So this is why you can eat an entire bag of potato chips and still feel hungry. Because, and now you've given yourself an entire, exactly. And you've given yourself a really fast burn carbohydrate, maybe a fast energy boost, but you are going to be gone in about an hour from now. So it's looking for nutrients and slow burn nutrients. This is why you can eat a bag of almonds and feel like, actually, I'm pretty good. I'm pretty good because it got the nutrients it needed out of those almonds. Where if you ate the entire bag of potato chips, you still feel hungry. You had the same or more calories, but lower nutrients. So if people are working on their weight and really want to figure out how to give their body the nutrients it needs, but yet stay slim, give your body nutrients, not calories. It's not about calories. It's about what's actually in those calories.
Okay, and the reason I'm asking all of these questions, and I'm glad we went down this path, I didn't give you any heads up on this, but this is the fascinating part to me because you're a dentist. Like, you're not, well, you're also a nutritionist. Yeah. But this is all of the stuff that you've learned and been engaged in since you had that experience of not feeling well and your path to this point. And the other reason I'm asking you all of this is because on the other side, after we do our 3 random questions, which is my favorite part of the podcast, on the other side of this, I want you to talk to us about how your dental health and the healthy decisions you make can help improve performance on a daily basis. I think all of us in the business world and people who are out working, and like the people who are listening to this particular podcast are, e-commerce entrepreneurs. Yes, they're running a warehouse and they're in the shipping world and they're running companies and I'm certain I feel like I suffer this like 3:00 in the afternoon. I'm like, I don't know what to do. At this point. Is it because I had terrible sleep? Is it because, and now I'm thinking, is it because there's something going on with the wisdom teeth that I had pulled when I was 15 or 14 years old? Anyway, I want to make that connection between what you're doing now and how people can improve their daily performance. Is that fair? Is that something you can talk about?
100%. That's my whole book. That's my whole new book. So I want to give you an analogy. If you cut your finger, and you put a Band-Aid on it. Does the Band-Aid do the healing?
No, the Band-Aid is a Band-Aid. It just stops the bleeding.
It stops the bleeding. It holds the 2 sides together. It does those things, right?
Yeah.
What actually does the healing?
Your cells.
You got it. Yeah. Your body, your cells. And did you have to tell them what to do?
No.
Because the immune cells came in first. They made it a little red, a little sore, a little swollen, a little whatever. They cleaned up all the mess. You didn't have to tell them to do that. Then the construction crew came in. The skin cells knitted themselves together so tight that it doesn't come apart again. Did you tell them to do that? None of that. So here's what we've forgotten in today's world. Our bodies know how to stay well. They know how to do it. So we've all been...
sounds so simple.
I know. But it is simple, but we've just forgotten it.
Yeah.
So what we instead ask is we ask, what kind of food should I eat? What kind of medicine should I use? What kind of doctor should I go to? Should I follow traditional, like the modern medicine, or should I follow like all the woo-woo crazies? Like, these are the questions we're asking. You're like, which podcast is right? Which influencer is right? Which supplement is right? This one, exactly. This podcast is right. But, which of all these things is right? It's the wrong question. Because all food, all supplements, all exercise programs, all diet plans, they're all Band-Aids. They are all there simply to support your body in doing what it already knows how to do. So the right question is, what do my cells need?
Oh, okay. Let's leave that there.
Okay.
What do my cells need? That's perfect. Okay. 3 random questions. Maybe not so random. Okay. Did George Washington really have wooden teeth?
Yes, he did. He had a very interesting denture that was wire, and there was some supposedly like walrus tusks in there and some wood, and it was all on this hinge because by the time he was like late in his presidency, he had 1 tooth left in his mouth. He had such bad teeth. George Washington had really bad gum disease, and he had chronic infections, actually. I don't know how he survived as long as he did, but this is actually how he died. He died from a dental infection that they then did some bloodletting for to try to get rid of the infection, and he ended up dying from it. But he had these like hinged dentures, which would have been so hard because they would have like open. Do you know what I mean? Like you put them in there and you had to like keep your jaw closed to keep the teeth in. So he very rarely wore them. And in the picture on the $1 bill, they stuffed his mouth with cotton because they didn't want him to look like he didn't have any teeth. Oh. So now you can go look at the $1 bill and you can go look at that picture and know that face is stuffed with cotton. So dental issues were his downfall.
And he died.
He died from one.
Of a dental issue.
Yes.
Okay, so playing devil's advocate, if the root of 60 to 80% of your health issues start in your mouth, how on earth did George Washington accomplish so much with constant dental?
Yep. Well, I think that we probably all would have liked him to have lived another couple decades.
No kidding.
People lived another couple decades past when he did. So it did end his life early.
Okay.
Yeah.
I was just recently in Philadelphia and got to see in one of the houses, the Powell House in Philadelphia. And in that house, if you ever have a chance to go, it's a fascinating tour. It's a tiny little house. And Mrs. Powell used to host Benjamin Franklin and George Washington and all of the patriots in Philadelphia. They have a lock of his hair encased. And I just thought that was fascinating. Could you take it? I wonder if he had any mercury. Would he have had
probably
mercury
had some
poisoning at this time?
Yeah. It probably had some. They were probably removed because he lost all of his teeth.
Yes. Okay. If you had to say, if you only had one piece of advice to offer somebody for dental hygiene that would be the most meaningful thing they could do, what would that advice be?
Cavities are not a deficiency of fluoride. So
cavities are not a deficiency of fluoride. Man, like here's what I grew up with the food pyramid. That's been completely obliterated. I grew up with, you have to have fluoride in, and that was the thing.
Yep.
And I always brushed with fluoride. And then I would go to the dentist and I would get a filling. I was like, I am brushing my teeth.
Exactly right. Exactly right. And you have the guilt now, and your mom's making you pay for your fillings and, whatever.
Yeah.
So,
and they're mercury laced. I mean, geez.
Yep.
Okay.
So cavities are not a deficiency of fluoride. They're a deficiency of minerals. So if you're getting tooth decay, it means you need minerals on the outside of your teeth. So now instead of fluoride, because fluoride decreases thyroid function. It decreases IQ levels in children. It changes your bones. Like it does all sorts of bad stuff. We don't need it. You need more minerals and the minerals that teeth are made of. So you're going to brush with it's called hydroxyapatite. That is the mineral your teeth are made of. And now there's toothpastes, tooth powders, mouthwashes, all with hydroxyapatite in them. This is what you need.
Okay. So is this the product that you've created?
Yes, so we can now get to shipping if you want.
Well, we are going to talk about shipping.
A very short version of it is, because when I found out that cavities are not a deficiency of fluoride, I said, okay, everybody needs hydroxyapatite then. I didn't want to make a toothpaste. I didn't like a lot of the toothpastes on the market because they had things in them that made them into a paste that weren't for health reasons. And so they were detrimental to health. I'm like, well, I don't want this because it just makes it like slippery or foam up more. I don't want that. I just want the hydroxyapatite. So yes, Carlin from Just Ingredients, actually, she and I worked together to create a tooth powder. I formulated it. She marketed it. That was our agreement. And we created a tooth powder with hydroxyapatite. And we now have over 1 million of these that have been sold. And people are like, I will never use anything else but this.
You're not the only dental professional who knows this. Is that fair to say?
That's fair to say, but this is definitely not the norm.
Okay, so but generally, would you say that the dental profession understands what fluoride is?
No,
and
they do not. We are all told that it is the gold standard, and that is the only thing we recommend.
Because I still go and I get a tube of fluoride toothpaste.
Exactly right. Nope, it is
my
not.
Little gift bag.
And it will never change inside of the profession. It just won't. So it has to change from people asking their dentist to do something different. To say, I don't want that fluoride treatment today. And I don't want that fluoride toothpaste. I'm using this instead. We really like it. What do you think about it?
How do you approach it? Like, I love my dentist.
Yeah.
We went to college together.
It's great.
He's the best.
Awesome. Yep.
And
just don't use the
now
toothpaste
I'm
that
gonna
gives you in your bag.
I'm going to say, hey, well, now I feel like this is partly my mission. Like now I know it's like I have the knowledge.
I've infected you. I like this.
Yes, exactly. I'm going to do what you're like. Now I have to do something with it. What is it that you always say? Like, just watch me.
Exactly.
Not just watch
just
me.
watch me. Just watch
I'm
me.
going to change the world.
So you got to use a hydroxyapatite tooth care product. That is
Okay.
the number one thing you can do for your dental health.
Is there... Okay, I don't want to get anybody away from the product that you created, but are there other products on the market
Yes,
available?
that's why I say that. That's why I say hydroxyapatite. Go on Amazon. You're going to find a whole bunch of them.
Okay.
Yep.
Is there anything you should stay away from? Or is just like, that's kind of thing, hydroxyapatite?
Hydroxyapatite.
Okay.
That's the key. It's just the minerals that your teeth are made of. Because when you have acid on your teeth and people think, well, sugar causes cavities. Well, no, sugar doesn't. The bugs in your mouth eat the sugar and they poop out acid. That's my favorite way to say it because kids are like, gross, but it's true. It's like, it's what they excrete, so the bacteria excrete acid. The acid dissolves the minerals. So does sugar cause cavities? No. Sugar feeds the bacteria that cause the cavities. So they leave holes in your teeth. The acid leaves holes in your teeth.
Uh-huh.
This fills the holes back in.
I was just going to ask. That was my next question. Okay.
This fills the holes back in.
You can fix it. There's a fix.
So you can actually fix cavities that are on the surface layer of teeth because it's just a hole that bugs have crawled into. So you fill up the hole.
So that's not like an internet myth. Like you can fix cavities. That's a real thing.
It's a real thing.
I love it. Okay. Now we're going to talk about shipping. This is really going to test your knowledge of shipping.
Uh-oh.
Do you know much?
I have zero knowledge in shipping.
Okay. This is a question
I
that
will
we
fail.
ask all of our contestants on the Know Your Ship.
Price is Right.
On the Know Your Ship podcast. I used to watch The Price is Right. Would you rather ship your pants or ship your bed?
Well, out of my warehouse, my pants, because we can't fit my bed.
You can't fit a bed in your...
We could, but we couldn't really use the current shipper we're using.
They don't ship
Beds.
larger things?
No.
Have you ever experienced a shipper shipping beds?
No, because tooth powder's pretty small.
So you would rather ship tooth powder than a bed or your pants?
In our current facility, yes.
I think that's a reasonable answer.
Yes.
Okay. Back to the cells.
Yes.
Are you ready for this?
Sure.
Well, you brought
Bring
it
it
up.
on.
This is your stuff. Okay. So here I am. I'm a guy. I want to figure out a way to improve my performance, daily performance. And let's just say I want to improve my performance at work. I want to be a better leader. I want to be a better example. I want to have more energy. I want to accomplish more. I want to be more focused during the day. And so I'm doing the right things. Like I'm eating pretty well. I exercise daily. I don't sleep well. I try to get enough sleep. I, keep myself intellectually stimulated, and none of it is the answer.
None of it gets you past 3 p.m.
Yeah.
Yep.
Yeah.
Yep.
Okay. So now all of your experience, and I'm saying this to you, let's just like I'm in your office.
Yep.
What are you telling me?
I'm going to tell you we need to find out what cells need help first because it's so overwhelming in today's healthcare world to do all the things and what actually works and what actually moves the needle and what doesn't and what is just a whole big waste of time, right?
Yeah.
A waste of money and everything else.
Yes.
I joke that I have a supplement graveyard in my house because, you take a supplement for a little while and like you're so into it and invested into it. And like 3 months later, you think, I don't know if this is doing any good. So you put the half empty bottle in the cupboard along with the other supplement graveyard, dead supplements, and then you go and you buy another one.
Yeah.
And I literally have a graveyard. So that's just such a waste. It's a waste of time and effort and energy and everything else and money. So what I did is as I was studying and really trying to figure out how to get well, I started studying a bunch of traditional medical methodologies. So Chinese traditional medicine, Ayurveda from India, Native American medicine from the United States, German herbalism, Korean medicine, all of these things I started studying. And it was so confusing.
Okay, don't lose that train of thought.
Yes.
So confusing. I just want to know, as you're studying all of these things, maybe you're going to get to this, but as you're studying all of these things, which seem to me like so different, is there any similarity between? Okay,
Perfect question. Perfect question, because that's exactly where I got to.
Hey, that's just what I do.
You're just so smart. Exactly. So you must have better performance than you think. So
Occasionally.
Exactly. Right.
It's just like a blip. You know that song? I'm not as good as I once was, but I'm as good once as I ever was. That's how it is.
It's good.
Okay.
So yes, exactly that. It was so confusing. And I thought there's got to be a common thread here. There has to be something that's going, because all these are different methodologies talking about the same body, but they just live in different areas of the world and they're using different languages and different, so they all had two things, but really one common thread. They all talked about the seasons of the earth and the elements of the earth, all of them. They classified bodies as the fire element. Like, I'm a fire element. I know that shocks everybody that's ever known me.
Well, yeah, like that would be in the color book, you'd be the red.
Exactly right.
Yeah,
exactly
okay.
right. Exactly right. So they use those things to classify bodies, but they also use them to classify how to get well. Like, I'm too damp right now, so that's a water reference. All those things, all of these use these words and phrases. And
all of these disciplines.
Every single one of them.
Okay.
Tibetan medicine, like all of them. So I started looking at it. I took everything that they had and I put it into a huge database of symptoms. And I said, okay, so this says if you have this symptom, you are water. You're water deficient, or you need water. And I created this assessment that you take that's based on your symptoms. So now this is what I would tell you if you're sitting across from me. Obviously, you're going to turn right here in the middle of the book. I think it's chapter 11. And you're going to go to the assessment.
That's a good, we'll give it the plug right here.
Exactly.
You're
going to open the book. You're going to open the book and go to the assessment, or you're going to go to livingwellbook.com, because on there you're going to get the assessment that's digital. That's even cooler, because then when you get your result, I'm going to tell you what it means. So what I'm going to tell you is which cells need help first, and I'm giving you a season. So let's say for you are in a spring season, which means your liver and gallbladder need help. That's where you're going to start. So everything you're doing is focused on those organs. And then I'm going to tell you what to do about it. Okay, here's what you're going to do in the morning. Here's what you're going to drink. Here's the one supplement you're going to take. And you're going to do this for 2 months until you retest. And it goes, guess what? You're now in a fall season. Now your lungs need help first.
Wait, now it could be fall, but I'm in a spring season.
Correct.
Okay.
This is all just about which cells in your body need help right now.
Okay.
And it uses all these traditional methodologies because they are the ones that said liver, gallbladder is spring.
Okay. So would I be outside of being classified as a season based on the test, generally are people a season?
Yes, actually, that's a whole nother book, but that hasn't been written yet. However, this is more about your symptoms and your symptoms today.
Gotcha.
This is where do you start today? Because,
Yes.
for example, when I'm patient zero for all of these things, I tested, I was a spring. So my liver still needed help to detox the mercury crud. So I worked heavy at it. Instead of worrying about every other thing, I started there. And guess what? All the other symptoms started going away, because it was my foundation that wasn't right yet. So I needed to get it right first. Now I'm testing, and I tested as a winter. What does that mean? My kidneys need help next, which is super interesting, because guess where mercury detoxes from fillings? Through the kidneys. So it moved from my liver, which needed help to get rid of it, to now my kidneys, they were damaged by it on the way out. So now I'm working on my kidneys. So what this does is it simplifies, like we have mountains of information on both sides, all about medicine, all about what we should do and what we should eat and what we should, blah, so much. How do we pick our way through it?
I don't know.
That's where you take the assessment, and it says you need to start with your liver. That's the place you start, and then I tell you exactly what to do.
So that's really interesting, because there's a possibility that I have the right supplements in my cupboard.
Yeah.
And I'm just not taking them for the right
Or
thing
the right
at the right time. Yeah.
You got to start at the place that your cells are saying you need help first. So the symptom, like I said, the symptom is the signal. And in today's world, we just cover it over. We put duct tape over the warning light on the dashboard of the car. It didn't fix anything. We kind of sort of feel better, but it didn't fix what was really wrong. Your cells are trying to tell you what's wrong, and you're not listening. But most often, we just don't know how to interpret it.
No.
We don't know how to read what it's saying. So that's what the assessment does, is it interprets your signals. It interprets your symptoms and says, this is what you need first, and this is where you're going to start.
Yeah. Okay.
And that's where you go.
Well, it seems very reasonable. You're not feeling great. We need to have an assessment, and we need to determine how to start.
And this is a simple assessment. This isn't a blood test, a stool test. You don't have to do all the fancy stuff. It's literally you go and you check some boxes and say, yeah, I got this, I got this, I got this, I got this. Okay, great. This is where you start. That's it.
So let me ask you this, because there's so much, like you said, there's so much stuff out there. There's so much information, and there's all of these all of this supplementation and what you should take and how you should eat and what you should eat in times of day and everything else, I'm guessing that there's some truth in those things.
In all of them.
Yeah.
Yeah, they're all Band-Aids. Band-Aids help your body heal. But Band-Aids support your body. So every cell needs 4 things. And if we can help one cell, we can help them all. They all need supplies. So that's going to be your food, your water, your air. They all need support. They need like their garbage taken out. They need security. So like you can't get sick. You know, you got to be able to protect yourself from viruses. And they need signals. They need to be able to talk to each other. So we need things to help with all of those. You just need to know which thing to start with. That's the key. Which one do we start with?
Yeah. I'm sold, but I still have a lot of questions.
There's a lot of questions, and it's a complex topic to cover in 5 minutes.
I know.
Yes.
But are you going to put me on some disgusting diet that I don't like?
Nope, because everything that you need comes from the earth. So as long as you don't mind eating an apple or a carrot or some lemon water in the morning, you're going to be just fine.
How do you feel about who does this? We had someone on our podcast, and I believe it's celery water. Have you heard of this?
Oh yeah,
celery water. How do you feel about celery water?
Celery water is very full of minerals. So if your body it's actually a winter need, because in wintertime it's your bones and your teeth that are really struggling. So celery water is okay for people in the winter. But interestingly enough, I did celery water years ago, and I craved it every single morning until one morning I couldn't drink a drop. And I didn't get it then, but I get it now. It's because I had enough, because my minerals were topped off and I didn't need it anymore.
How often do people not listen to what their body is telling them?
Every single day. We covered over. I mean, even caffeine, even, an energy drink or coffee in the afternoon, what it's doing is it's actually putting duct tape over the body's symptom saying, I'm tired. And so we instead hype ourselves up on caffeine, push past our energy reserves, and then you have a big old crash because you actually expended energy you didn't have. It's like it's overdrafting in your checking account, You didn't have it, but you still spent it because caffeine told you really weren't tired. So often we're turning off these symptoms and signals just to push past them instead of saying, how do I actually just get the energy I need?
Okay, so but people do have legitimate, I would say this about myself, people do have legitimate cravings. So for a coffee or something. And so are you saying that we're not, like, the craving that we're experiencing we should be looking towards something else? Or are we actually craving coffee? Like, that's the right supplement at the time?
Good question. I think it can help with your energy levels because it turns off your symptom, but it doesn't help with your energy creation, which is what you actually need to push through. Does that make sense? You're using fake energy. Your body says you got it, but you don't really have it. So you're craving the energy. You're giving it the coffee. But you need the energy creation pieces as well. You need the apple. You need the electrolyte. Then drink the coffee. It
totally makes sense. Yeah. But then there's this whole, like, it's a lifestyle of, like, Starbucks has made a fortune on creating a lifestyle of you going in and you have your specific coffee that you drink, and it's all of this crazy combination,
full of some carbohydrates.
All of that. Okay, so can you supplement your coffee? Like, so let's say it's in the afternoon.
Coffee has a lot of great things in it, actually.
You're craving a coffee, but you're saying maybe this is just covering up. Can you supplement your coffee with?
Do both.
Yeah, that's what I mean.
Do coffee and an apple, both. That way you have the energy to push through and you have your coffee craving fixed.
You know what goes really well with coffee?
Yes. A donut, a chocolate donut.
You know exactly what I'm going to say. Is that not the right carbohydrate at that moment?
It's a simple carbohydrate that'll spike and then crash. So it's just all about how long do you want it to last?
Yes.
How long do you want it to last?
It's so fascinating. I love this conversation. I really appreciate all of your insight and all of the work that you did. I can't believe that you've put this all together. And guess what? We should have known. We should have known because we learned this when you were a little kid. Exactly. And you were just like, your mom was like, people can't hold you back. You just keep going. And you were like, just watch me and look where you are.
Yeah. I'm not a good sitter. I just don't sit well.
What do you love? What do you love about what you do?
I love it when the light comes on in people's eyes and they go, I get it.
I know. I feel like I've had that experience.
It's like, I get it. And I know that I have changed the way somebody's thinking. There's something that I talk about in the book too about epigenetics. Every single cell in our body has the same DNA in it. Did you know that? Every single cell.
Yeah.
So your
that.
bone cell has the exact same DNA as your skin cell.
Mm-hmm.
So how does it know to become a bone or a skin? How does it know how to do that?
Mm-hmm.
It's because it's read in different ways. So it's like a recipe book. And in that recipe book, we can put sticky notes if we want to say, only put half a cup of flour in instead of a third of it, whatever it might be, we can change it.
Mm-hmm.
And that's the great thing about as we learn. We're actually epigenetically, we're changing the way our brain is working. We're changing the way our brain is seeing things in the world. We're literally changing ourselves and our wellness because of the things that we're learning and then implementing, obviously. But our genetics, they don't tie us to anything because we can change the way that those genes are read because it happens every single day.
Interesting. Okay, just a few more questions. You've been so thoughtful with your time. Is there anything in our diets that we should, this is the thing that you should just cut it out. You don't need it. It doesn't feed your cells. It's not helpful. If anything, it's damaging. It's going to cause inflammation or whatever. Mm-hmm. Is there something out there that you would say, just don't do it?
Really, it's that simple carbohydrate. It's that potato chip, that pretzel, but it's everybody's go-to. So I never like to take too many arrows in the back, but it's really not serving you. If you could do dried apple chips instead of a potato chip, you're going to get 10,000 more, energy out of that.
You know what Cara Lynn does really well? Lots of things.
Yes.
But you know what she does really, really well? Okay, so people will walk into the supermarket and they're like, wow, I should make a better choice. But I'm getting the potato chips because I don't know what the other choice is.
Yeah,
what else am I going to get? Have you ever seen her charts?
Mm-hmm. Yep.
She has the chart.
Good, better, bests.
Yeah. Okay, here's the potato chips. No, choose this.
Exactly.
Okay. Where can people, outside of going to Cara Lynn's, where do we find that? If you're craving potato chips, no, don't do potato chips. Try this. Is that written down somewhere?
Hers is awesome.
She
has the most comprehensive view of it for sure. In my book, I actually have a good, better, best wellness, how to eat for wellness guide, but it's not as specific as hers. So go check hers out because she's specific for brands even.
Yeah.
Because it's that. It's this, okay, I really want a chip. All right, this one's a great one. Do this one instead.
Oh, yeah, that's true. Okay, and I'm sorry, I'm jumping on your podcast to promote Cara Lynn, but you guys work together.
I love Cara Lynn. Yep.
Okay, just ingredients.
Promote
you
her
can go
all that we want.
It's on her. I don't know if I found it on her website, but it's on her Instagram.
Yeah. Yep. She has a lot of charts there.
Yeah,
she's fabulous with that.
It's really good.
Yep.
It's really good. Okay. Well, you've written 6 books. You've now left your. I'm going to say you left your dental practice. Is that fair? Is that
we call it?
Right
we left the chair. We left the dental chair.
You left the chair.
Still there.
Do you and your husband still talk about the North Door? I think that's a great story.
The North Door.
The North Door. You're I don't know which was north.
Oh yeah,
I
get more. He doesn't remember saying that.
But you have the good memory.
I remember it all.
You have the great memory. Okay, so and you don't like to sit still, and you gave us a little preview, but tell us what is when you wake up in the morning and you put your feet on the floor, you say, this is my mission. Mm-hmm. Where are you headed? Yep.
Before I even wake up, the second I have cognition, my brain is awake. Before my eyes are even open, I say, all right, Heavenly Father, how do I help people live well today? Oh. And I usually get a download. So I have to get up real quickly and write it down because I get a download. Okay, you got to do this. I'm like, okay, got it. We'll do it.
That happens?
It happens.
Wow.
I get 2 or 3 ideas. And I'm like, all right, that's what I'm going to do.
And then you go execute.
Yep, because basically my mission is to help people live well so that they can live their mission. Because everybody has a mission. Everybody has a purpose. Everybody has a reason we're here and wants to be more and wants to be better,
Yes.
So my mission is to help you live well so that you can do that thing that you're meant to do.
Okay, what didn't we cover today? What is something that we didn't cover that you want people to know?
I think we covered pretty much anything.
You did a lot.
Exactly.
We did a lot. It was fascinating. I learned so much.
Thank you so much. The only thing we didn't cover is about shipping. I did start all of my shipping out of my basement. So people say, they joke, they're like, oh, this started in this basement. It really did.
It really did.
It really actually did. We carried every single bottle of tooth powder downstairs to put it in boxes to then carry it all the way back up the stairs out to ship it every single day for a year until we finally got a warehouse.
Do you know, that's amazing. And do you know how many, that's a recurring story on this podcast.
It's just what it is.
Is when people have started, they were like, yeah, well, I started shipping this out of my garage. I started shipping this out in my bedroom. And and then all of a sudden.
Yep. Now it doesn't fit in the basement anymore.
Yeah, that's amazing.
Yep. Nope.
Thank you so much.
Well, thank you.
I hope you'll come back and visit us and you'll give us an update and how you're changing the world. You're changing the world. I'm really interested now to see how the dental industry adopts this. It feels like there's a huge opportunity.
There is. And today, the health is the new health is the new beauty. Everybody's talking about health. Everybody, even the politicians are talking about health now.
Yeah.
So it is now the thing. It's now the talk. And it's not going to change inside the professions. I'll just tell you that. That's not how things change. It happens because all of you listening want something different and you demand it, and then it will change.
Yeah. And isn't it great that we're talking about health? I think that's an amazing thing.
It's amazing. Yep.
Dr. Michelle Jorgensen, thank you so much.
Thank you.
Come back and see us.
We will do it.
Appreciate it.
Thank you for listening to the Know Your Ship podcast presented by eHub. Don't forget to subscribe and leave a review.